Hello everyone, my name is Maharlika Diarse and I am going to be doing the Ophthalmic medication administration. And before we start, I have my Nightingale badge, Nightingale scrub top, Nightingale scrub bottom. My hair is pulled back. I don't have any acrylic or gel nails. No jewelry hanging. And for our supplies, we have 2 napkins, a pair of gloves, our patient, Miss Jones, and our Timolol solution that's ordered. This is typically single use. This is single use, but these are the only ones that came in the skills kit. So we are just going to pretend that this is a bigger bottle and it's not a single use. Alrighty. And first we have to verify the provider's orders. We will verify the provider's orders that he had ordered Timolol 0.25% solution and 1 drop in each eye 2 times a day. And before we start, we will verify the 6 rights of medication administration. It is the right patient, the right medication, the right dose, the right time, the right route, and right documentation. Alrighty. And we are going to look at the EHR to make sure that this is the right Timolol, that it is 0.25 solution, and it is. And we are going to start. I am going to knock on the door, provide the privacy curtain. I'm going to wash my hands. All right, Miss Jones, can you please verify your name and date of birth? Verify the name and date of birth. Alrighty, and our second verification, I have the Timolol that is prescribed to Ms. Jones, and I'm going to look at the EHR to make sure everything is aligning right and everything's aligned right. Alright, and that is my second verification, that she is Ms. Jones and Timolol is ordered for her. Alrighty, and then now we are going to make sure that Miss Jones is not accompanied with any of her family members, and there is no family members at this time, because if there is, then it would be a HIPAA violation, and we do not want to do that. And now we are going to explain to Miss Jones why this was ordered. Miss Jones, the Timolol was ordered for you because the provider said that this is a beta blocker and it will help decrease the pressure from your eyes, and it is in a gel form. All right, do you have any questions right now? No. Ms. Jones, do you have any allergies to food, medication, vaccines? No? Okay. And then I just wanted to let you know, Ms. Jones, that the side effects are burning sensation, sensitivity to light, and or irritation. And then there could be some adverse effects as well, Ms. Jones, which is chest pain, trouble breathing, and fatigue. If you are experiencing any of these adverse effects, just let us know immediately so we can come and help you. All right. So now I am going to wash my hands, and I am going to clean Mrs. Jones' eyes before we administer the medication. So I'm going to wash my hands. I'm going to apply clean gloves. And with my non-dominant hand, I will clean Mrs. Jones' eyes. Miss Jones, I'm just going to clean your eyes from your inner canthus to your outer canthus. Alrighty, here we go. So I'm going to clean Mrs. Jones' inner canthus to the outer canthus, and now that side is done. Now I'm going to switch the side of the napkin with my non-dominant hand and her other eye. Miss Jones, I'm going to do your right eye. I'm going to clean from the inner canthus to the outer canthus. Alrighty, and I'm going to dispose of this into the trash. Alright, and Miss Jones, are you okay? No, you're okay? Alright. Alrighty. So if Miss Jones had any crustaceans in her eyes, we can just get a warm wash rag and just leave it on her eyes for about 2-3 minutes, just so the crustaceans can soften up, and then wipe from her inner canthus to her outer canthus. But in this situation, she does not have any crustaceans and she is clean and she's ready for the medication administration of the eye drops. Alrighty. Since I only have one pair of gloves, I'm going to pretend that I wash my hands and I put a new pair of gloves. So these are new. Alright, Miss Jones, I'm going to administer the Timolol now. And are you in a comfortable position? You're already in the chair, sitting upright, and your neck is hyperextended just a little bit, just so I am able to administer the Timolol into your eyes. Alrighty. So before we do so, we are going to check again on the EHR. Just make sure that everything is aligned right, and this is the right Timolol 0.25% solution, and this is for Ms. Jones. And we checked all the rights and we are good. Alrighty. Ms. Jones, I am going to hold this new napkin, and I am going to apply pressure onto your cheekbone. I'm going to expose the conjunctival sac, so I can drop the Timolol into your eyes. Already, so I'm going to put a little pressure on the cheekbone just to expose the conjunctival sac, and it's exposed, and my dominant hand, just a light pressure on her forehead. We do not want to hurt the patient at this time, and she is hyperextended, and I am going to go 1 to 2 centimeters away from her eye, and I am going to administer the drop. Alrighty, I administered the drop, and now I'm going to apply pressure 30 to 60 seconds into her nasal lacrimal sac, and we are going to make sure that Ms. Jones does not blink, but if she does blink, not to worry, we have to redo the whole process again. But at this time, she's doing great and she's not blinking at all. Alrighty, we held it for 30 to 60 seconds. Alrighty, Ms. Jones. Now I'm going to flip the other side of the napkin. Now we are going to do your right eye, alright, Ms. Jones? Alrighty, so now I'm going to expose the conjunctival sac, and it is exposed. Alright, Ms. Jones, and then I am going to go 1 to 2 centimeters away from your eye, and I am going to administer the second drop, or the first drop, into your right eye. Alrighty, it is there. And now I'm going to hold 30 to 60 seconds at her nasal lacrimal duct. Alright, we are good. Alright, Ms. Jones, are you okay? Everything is good? Alright, Ms. Jones, are you able to blink for me? Alright, are you having any symptoms, any effects? No, you're okay? Alrighty, so now we are going to make sure we put this bag into the nurse cart, and we will make sure to properly store a bit. Let's just pretend I stored it and it is locked, and I'm going to dispose of this into the trash can. And now I'm going to take off my gloves, and I will dispose of it into the trash can. I'm going to wash my hands. Miss Jones, are you in a good position? Are you okay? You want to stay in the chair? All right, here is the call light. And let me know if you need anything. If you are having any effects, we will come in here immediately. Alrighty. And then I'm going to wash my hands. I'm going to document my findings, and that is it. Thank you so much.